2. Welcome especially to my co-chair, Dr. Mark Ricketts, and others that will be joining us here in the council chamber. We're corporate here in the council chamber, but I know there are lots of officers and member colleagues joining us online for various items, and welcome to all members of the public that are watching. This is a hybrid meeting. The COVID rules obviously lapsed, and meetings, the core meeting to be core, has to take place in person, but obviously we take a very precautionary approach here in Hackney and welcome contributions virtually, but those that are attending here in the council chamber are formally attending, and those online are sort of present in terms of how they're represented, I think, in the minutes. If all, as is customary, all questions, comments through the chair. I am logged into the meeting. Peter as clerk is logged into the meeting. I'll be able to see the raised hands function. Please don't use the chat to continue a debate. Just use it for attracting the attention of the chair. We would ask that anyone attending in person raises a hand before contributing to the meeting, especially if people are obviously presenting online. We don't want to end up with 2 different meetings, one online and one in person. We have here, as I said, Dr. Mark Ricketts as co-chair, Councillor Kennedy and Deputy Mayor Bramble in the chamber, along with Chris, our Deputy Director of Public Health. We've got a packed agenda, as you would expect, with contributions from both Health Watch and members of the public, as well as some important reports. I will move very swiftly, though, into the main body of the meeting, and obviously, as I said, who I am. For the purposes of this meeting, while I am Mayor of Hackney, I'm also co-chair of the Health and Wellbeing Board. I've got apologies from Stephen Haynes. Andrew Monk, I think, is representing him in his place, and I can see Andrew on the call. Are there any other apologies for absence?
Rosemary Juara.
So Rosemary, who represents HCVS and is a stalwart attendee and contributor. So her contribution will be missed, but I hope she's well. Declarations of interest. Are there any undeclared declarations of interest? Susan.
Hi, I'm a Labour councillor in Newham, and also when it comes to the item 14 on Connect Hackney, obviously I've got an interest in that. I'm employed by Hackney CVS.
Thanks, Susan. Really welcome. Any other declarations? Not that I'm seeing, so thank you. If during the course of an item something does come up, please just let me know. And if it's in any way sort of complicated, do put it in the chat to help Peter with the minutes. Minutes of the previous meeting, which should be in the board pack. Are there any comments or contributions, or are we happy to agree them? Obviously, colleagues are still joining. Dr. Ricketts, Mark.
Just a small point, really, on item 7.11. It talks about integrated commissioning board, and actually that doesn't exist anymore. I just thought it might be a bit confusing to people, so I think, where does that come from? It should be the Integrated Care Partnership Board, which the Integrated Care Commissioning Board has become.
It's a fast-moving place out there with acronyms, and ICBs are moving up and down the structures and system. I think Dr. Husbands has put in the chat, and it's certainly my position, that on one of the ways of accessing the papers, some of the items aren't open. I assume, and I was going there myself, that the public link does work for those papers. So I would suggest going through the website and checking the public link if that works, and then perhaps Peter can help, or colleagues on the call can help with any of the other items. I couldn't, I've seen the minutes previously, but I couldn't open them on the link I'm currently working through. So just give a pause. But yeah, so that link that Mario has posted does work in terms of the minutes. Beyond Mark's helpful suggestion, and I saw nodding in the room, are we? Sandra, do those links work?
So I can open it in preview, but I can't. But that's fine. I've got that on the website, so I'll just toggle. Thank you.
No problem. Dinah.
I apologize, Chair, if it's not the right time to raise it, and maybe I can raise it at a different time if not appropriate right now. But I just wanted to ask, with regards to the item 8.8 in the minutes, so I have not been told definitely whether, for instance, the start of the financial year is a good time to initiate the GSNA process. So I've requested the board to provide with a steer when would be the good time to start the cycle, the annual cycle. For instance, we could do it every calendar year, every financial year, but that has not been confirmed by the board.
We haven't fed back to you on that. Is that
No.
So that's an action that we need to sort of capture to do before the next meeting. Is that correct?
Yes. So I've been told that I will be given an answer at this meeting. Last meeting.
Any advice on that from anyone?
I could suggest financial year, but it's up to the board to agree or disagree.
I think the financial year and the municipal year are pretty aligned. There's obviously a slight gap. That strikes me, given where we're at with some of our other strategic work and potential for a new administration. But this isn't something that we covered in the pre-meet explicitly. So I don't think I was at the last Health and Wellbeing Board. So because I was at COP26, so I don't know the shape of that discussion or that item, so I feel a little bit on the back foot. Sandra.
I'd just like to add to what Diana's to put some more context around her question, which is that we could start it at any point that's useful for us in terms of our availability to do the work. But what we were trying to get at was when, in terms of the planning cycle, would it fit in best with other people? So we're ultimately trying to be as flexible and as useful as possible. And so getting some feedback on that would be really helpful. If not today, it would be really helpful if the board would consider that now and then respond by the next meeting. Thank you.
Before I bring in Chris, just to help the board and colleagues, is this given how it's sort of phrased in the minutes and the developing work around the ICS, and I know that's had a slight slip to June, isn't it, for a start date? Is that the core question, that it's more for wider health system colleagues than a sort of political direction from the Health and Wellbeing Board? Obviously, we're seeking
it's for all
both
board
here.
partners, not just the NHS partners. So it includes the political steer and the steer from other colleagues in the council and other parts of voluntary and community sector partners. When is it most helpful for you both to engage in the process but also to get the output?
Okay, I have some thoughts on that, Chris.
Thank you. So it was just in terms of, I think the NHS cycles, it tends to be around sort of September, October time that those discussions about commissioning decisions for April. So that seems to be one of the cycles. But obviously, I think there's a difference between when we start the process and then when we actually kind of conclude that annual process. So my view would be, if we were to do it on an annual basis, calendar year, it would probably be a little bit out of date. But if we were to do it on the financial year, I think that would probably deliver what you'd need around that September time to help inform those decisions. But I think Diana's also highlighting that we want it to be an ongoing process, because often JSNAs are quite static, but actually the process that's been outlined is much more a dynamic one, so that the actual JSNA at any point in time will be reasonably up to date, rather than what used to be the case in most places where you have a JSNA process that delivers a product and then it ages, obviously, over that year until it delivers another annual JSNA.
Thanks. Before I bring in Laura, just a sort of question for colleagues that they might help me with. When was our last JSNA, and what cycle is it currently on? Because obviously if we're proposing a change or continuation, that would be really helpful. I appreciate I should know the answers to that question myself. The second half of that question is its interaction with the Developing Health and Wellbeing strategy and some of the other strategic sort of documents that are shaping the sort of ICS work. And I suppose the third bit, I was in a very fascinating discussion with mental health champion colleagues on Tuesday with London councils, and they were thinking about the sort of things that they were concerned about coming out of the pandemic and making sure that they were sort of picked up in JSNAs, including looking at things like long COVID and the impact on sort of mental health. And obviously that's an emerging issue. It's linked slightly to some of the Health Watch questions. So I will go to Laura, but just on sort of if other colleagues could think about that in the context. I think if we can make a decision and steer now, that sounds like it would be really helpful to officer colleagues. And I'm not sure we're going to add a huge amount of value between meetings unless someone has a dissenting view. Laura.
Thank you, Chair. I think things are a bit fluid at the moment, but the normal way in the NHS is that we're sort of thinking now about investments for the following financial year. And so knowing around now of any great big strategic needs that need to be invested as part of that investment would be, in my mind, the logical way to set that up. Now, obviously, we're not going to manage that for this year, but it might be something that we need to lock into our joint system annual planning process to really pin it down for next year. And it may be that there are some very obvious things, perhaps guided by the work of this board or the topics, that we could do some fast work on to inform next year's planning, the planning that starts 1st of April, in this short period now, whilst we get a proper cycle going for the following year. Because I think things are all a bit out of sync with the change in structures and everything. But that would be how I've experienced it happening in the past.
Thanks, Laura. That's really helpful. Diana.
Just to answer your one of your previous questions, so I think the last JSNA we've produced was around 2018, so we haven't done much work since, or rather, it was using the data of 2018. So since the pandemic, the work has stopped really. So it's really good time to kick it off, and like Chris was saying, it's quite flexible. So we could trial it this year around. We could trial it about this time of year. I'm collecting all of the big wish list from all the partner organizations, and then we plan it, we stagger it. Obviously, we can't do everything at once. And then at the end of the year, we might produce a report for the Health and Wellbeing Board about how well we did with that model. And in case we can just alter it a little bit for the next time.
So does that suggest that even if we said do that work on an annual financial year basis, the outcome of that work wouldn't be available until the autumn? Is that what you're saying, Diana? So that it would shape next year, as Laura was hinting at.
Yes, and it depends what it informs as well. So if something is more urgent than other thing, then we would prioritize that. So like I was saying, so it would be staggered approach rather than all of the topics at once, because we also don't have enough staff to do all multiple topics. But again, we could try it this time and then see how it goes. And if it doesn't work, then next time we do better. That's the whole purpose of the new process as well, in building evaluation and also impact assessment into everything we do, so including the process.
Thanks, Diana. Helen wants to come in. I do also notice in a minute that we approved the process at the last meeting, so you were all content on process but not timings, just for clarity for new viewers, new attendees. Helen.
I wonder if it would be helpful if we set out for the board, possibly virtually, what the different priorities might be and a suggested priority order to address them in for this year. Because it feels like it's something that we might want to revisit in the future, but I think we're keen to kick it off as soon as possible.
Thanks, Helen. And I think that hints at the other challenge of this is, you know, packed agendas. The away day model is one method, the in-between engagement digitally is another, but we often can't get into the full level of detail at these meetings. So I think picking up what Helen said, I think some of that insight of kind of where we are and emerging will be good to sort of share as we work through what's being proposed. I think that's the sort of proposal Helen made. So I don't see any hands or other comments. We're basically saying we will start that work, I suppose, now, because we're not that far from the next financial year, but we would be quite interested in some interim contributions that could help some of that early planning and commissioning and some of the reviews that we're already committed to. And I do think as a context to sit alongside the Health and Wellbeing Board strategy in the summer, having some, I know that it has been a sort of involved in this process, but I would sort of value maybe being able to sort of see, even if it was that old data, alongside those priorities at the final agreement. But I don't want to second guess or get into last board's debate, because as I said, we've got a packed agenda. And maybe if anyone else has any comments or contributions on this or dissent, they sort of come back on email in between. But is that okay as an approach? Does that offer enough direction? Yeah, good. I'm seeing nodding, so I'm going to move us on. With those two changes and additions, and obviously that's an action sort of from here that would go in the action log. Can we agree the minutes? Thank you. So we've got the actions log, the 6 actions there. We've just added a change to the 4th action, which does suggest there were some timelines. June 2022. I don't want to reopen the previous discussion, but and Laura, yeah, there's a bit of a action there to sort of engage with Laura, and maybe Laura, Helen, Deanna, and Sandra just need to, you know, it seems here in the action we're going to do some further work on this, and then maybe reword that note based on the discussion we've just had, because it is sort of there as well. Sorry for not picking that up before we had the debate. Are there any other comments? There's an action in play by Andrew on health and housing. Is that in train?
So we haven't, Mayor Glanville, we haven't had an update from Andrew yet, but I've chased that, and we'll make sure there's one for the next board meeting.
Thanks, Donna. Okay, are we content with the actions? Good. Thank you. Decision log. That's it. Sorry, that's in the same actions report. I think it's a different tab. Is it? Or have you got a decision log elsewhere, Peter, that's not linked? It should be there. Any comments on the decisions log? Not seeing anyone. Okay, great. So, questions from the public. So, Claire, welcome. I think you've got a as set out question. Were there any brief additions that you wanted to make to the as set out question? So, your question is in the papers, as far as I'm aware. So, you've got a published question for the Health and Wellbeing Board. It has been shared. The normal practice would be that then you get your response and then you get a comment on the response that's from council officers. So, but I just wanted to give you the opportunity if there's anything else briefly you wanted to add to the question as written. Right. You can use the microphone. Can I just say that I'm finding it a bit...
So, okay, so the video won't pick me up. Okay, fine. But that doesn't help my hearing, it helps you hear me. That's right. Okay, fine. Is there anything more I wanted to say? I've been speaking to a number of people on doorsteps at last night's Hackney People's Meeting at the Town Hall, and there seems to be a number of people in the borough who are suffering from health complaints, respiratory things, who live on what we call sacrificial roads. I also had a long conversation with the woman who is in Hackney. She lives on Blackstock Road, and her son, I mean, it's a very tragic case, has been so impacted by the increase in traffic on Blackstock Road, which I think Islington reckons is about 68% up or whatever. And it used to be horrible because I've worked with the children at Embless School and I know what it's like. And I worked in Finsbury Park for 20 years and teaching. And her child has had to be removed from her home and sent to his father's house because the pollution is so bad that it's impacting on his breathing. I think a lot of people know because I've been very public about my condition, which was 2 months after the LTNs in my area. I live on Dalston Lane. I had to be put on an inhaler, and that was during the pandemic. I was being told if anybody comes into the house, you should open your windows, but I couldn't open my windows because the traffic is so bad. My breathing hasn't really improved. I went back and had an assessment, a face-to-face assessment, and found out that there was a 20-point decrease in my breathing. My partner's asthmatic and she wakes up at night and needs an inhaler now for the first time. She climbed Kilimanjaro 3 years ago. I cycled from Nicaragua to Panama 2 years ago at Christmas, as you might know. And this decrease in our health is just so dramatic. And I hear this again and again from people on Dalston Lane, on Graham Road, on Blackstock Road, and now people, I don't know if it's Manor Road or Mount Grove Road, a couple of roads. And I understand there's an asthma hotspot near Blackstock Road there. And I was just wondering, I spoke a little bit to my healthcare providers, Lower Clapton Health Centre, which is another really heavy traffic area, and have actually done some pollution monitoring in the health centre there with my Flow 2 personal pollution monitor, and asked if there was any way, and that's why I came here, that we could start monitoring and looking at those hotspots and the impact of the creation of pollution through congestion on specific roads and the impact on our health, because the people of Graham Road, Amherst Road, Blackstock Road, Dalston Lane, we're really suffering. I'm not alone in this, and I know that. Thank you.
Thanks, Claire, for adding that, and that was very powerfully put. We've got colleagues in terms of Councillor Coban, Tyler from the transport team, Tyler Linton, and there may be others. I think Councillor Coban's going to lead us off. and the response will be sort of read into the minutes. And Deputy Mayor Bramble wants to add something. I know I don't want to steal Councillor Coburn's thunder, and I think I add the most value in chairing the meeting, to be honest, today. So, Councillor Coburn.
Thank you very much, and thank you to Claire for bringing this very important question to the Health and Wellbeing Board. I've had the pleasure of meeting Claire quite a few times, and I look forward to another meeting that we're trying to schedule in the diary to talk more about some of the issues that you've raised, particularly on some of the roads that you've mentioned. And obviously, we remain committed to sort of working to reducing traffic across Hackney overall, and obviously improving air quality. But more specifically to your question, one of the primary aims of the low traffic neighbourhoods is to improve public health. The objectives include to reduce overall pollution for a majority of people and to encourage more people to take active travel, to walk, cycle, and to use public transport. Measuring the impacts of it is complicated and relies on a number of different indicators, and not all of this is available at the household level. So postcode-based health data, for example, can include a main road, but also an adjacent side street. It is known from widespread research that most of the impacts of a traffic scheme, good and bad, have a causational link to the traffic levels. For this reason, the majority of the monitoring effort has been directed at the traffic counts. These have been done at nearly 300 locations and 24 continuous counters using artificial intelligence to include pedestrian and cycle counts have been introduced across the borough. The new low traffic neighbourhoods schemes that have been implemented since 2020 and 2021 added to the existing 20 or so LTNs, some dating back to 1970s, where the Beauvoir and where you mentioned near Finsbury Park, of course, and were implemented in line with guidance from the Department of Transport for London, and are consistent with the Healthy Streets approach, public health recommendations with the National Institute for Health and Care Excellence, and the World Health Organization Health and Transparent Research. The new LTNs were introduced using experimental traffic orders to allow for an 18-month monitoring period during which they must be evaluated using a full set of data, including objective measurements, as well as considering the views received during the time. To guide this decision of whether or not to make the experimental traffic order permanent, a full comprehensive report is completed for each scheme. And this, you would have seen this from the Homerton Low Traffic Neighbourhood Scheme most recently. Each report contains an equality impact assessment for each scheme. As part of this, schools and other sensitive receptors are considered in detail. Analysis of air quality, road safety, and bus impact is also included. To date, one of these, as I mentioned, Homerton LTN, have been completed, and all the data has been publicly made available. And you can find this on the link that we'll be posting on the minutes of this meeting later. And this provides an idea of the level of detail the evaluation of the scheme goes into. These evaluations include detailed air quality analysis, although air quality is not the only factor in determining the health implications of the schemes. Public Health is working with pollution control officers to monitor the impact of air pollution on residents' health, specifically from nitrogen dioxide and particulate matter in the form of PM10 and PM2.5. These are the pollutants that are most associated with emissions from motor vehicles. We'll be looking at potential impacts, both positive and negative, that the implementation of low traffic neighbourhoods have had on air pollutants levels, and what this means for the public health of Hackney residents. This is being done using data from Hackney's extensive air quality monitoring network, and a map of the network can be found on the link that we'll be providing to you on the minutes later today, or whenever it goes live. In addition, air quality modelling has been undertaken for the following LTNs: Hackney Downs, Hoxton West, and London Fields. The monitored and modelled results are compared to air quality objectives to determine what the impact on air pollutant levels from the implementation of the LTNs means for public health. The analysis of potential impacts from the implementation of LTNs on air pollutant concentration levels and public health are found in the LTN DPDs, which will be made public. And as I said before, this has already been done for the Homerton LTN. In relation to the specific roads and schools that you mentioned in the question, Dawson Lane, Graham Road, Ballspond Road, Mosbourne Parkside Academy, Minig Kadesh Nursery, Cardinal Powell Primary School are all being assessed in air quality analysis of London Fields LTN. Meanwhile, Norfolk Road, Amos Road, Norfolk Junior and Infant School are all being assessed in the air quality analysis of the Hackney Downs LTN. For wider air quality monitoring data collected across Hackney, you will also see an annual status reports published on our website, which again, we'll be posting the link on the minutes of this meeting. You can also find out more detailed information on how Hackney is improving air quality within the borough, where we've just published an air quality action plan, which was adopted last year in August 2021, setting out 47 ways in how we plan to tackle toxic air pollution. We also went one step further and committed to the Welfare Organisation's targets on particulate matter by 2030. This includes measures to reduce negative health impacts caused by high levels of air pollution, with a strong focus on health inequalities. In terms of the wider impacts of transport on health, there is a robust evidence base of public health grade evidence behind the council's approach. The chief executive of Homerton Hospital wrote an open letter to the council in May 2020 saying, infrastructure for active travel enables people to exercise as part of their daily routine, and being physically active is an effective way to reduce rates of various chronic diseases, including obesity, diabetes, and high blood pressures. Public Health England has heightened the importance of increasing the proportion of journeys made by bicycle or by foot. The Prime Minister has told regional leaders to encourage people to commute on foot or by bike to help avoid a dramatic increase in car use after the lockdown. We very much hope that these initiatives will be installed across Hackney as possible. That was the call. The of schemes is consistent with the Healthy Streets framework and uses methods recommended by the Department for Transport and Transport for London on the basis of population level benefits for measures that restrict and reduce car dominance. Notwithstanding the difficulty of obtaining health-related data at a hyper-local level of detail, and accepting that health challenges can take months, even years, we should continue to work towards this health optimization. In this task, the Health and Wellbeing Board will provide guidance and challenge where appropriate. We are aware that there are ongoing studies that compares areas that have had LTN against similar areas without. This is being done on a London level and led by academics. This is a wide body of work led by Professor Aldred at the University of Westminster. This is referenced in our decision reports, and we are in close contact with the University of Westminster, which should enjoy a joint study using comparable data in the future. We consider the health of residents throughout the statutory evaluation of each scheme under the sections of road safety, air quality, the equalities impact section, and throughout where we consider the evidence of behaviour change and journeys being switched from car to active travel. These reports must, by law, be completed in a certain time frame, and although we're already going beyond our statutory obligations, the main reports are informed by the data available at the time. The scheme evaluation reports include much of the content that would be included in the health impact assessment, but under different headings. Hackney is committed to continual review of schemes, and this suggestion will be considered as part of an ongoing monitoring and review of the schemes. Furthermore, borough-wide trends will be captured when reviewing the impact of air quality on health as part of the upcoming wider strategy reviews, such as Hackney Transport Strategy, and it may be appropriate to consider these in that process. And the last point that I just want to make clear is your question is a very important one. And as we all know, air pollution, we just remember 2 weeks ago where we had guidance for people not to exercise outside because of how bad air pollution was across London. The answer to tackling air pollution is not to do nothing. Low traffic neighbourhood schemes are part of many solutions, one of many solutions that we have to take to tackle toxic air pollution. And ultimately, in order for us to really reduce carbon emissions and the nitrogen dioxide levels, we need to encourage people to walk, cycle, take public transport, and move away from their cars. Thank you very much, Chair.
Thank you, Councillor Cockburn, for that very comprehensive answer. And as I said, that will be included in the minutes. I know that Deputy Mayor Bramble wanted to come in. I've got one quick comment / question. Did anyone else want to make a contribution or assist in answering Claire's question? No. So my question for officer colleagues, or maybe Councillor Cockburn, to sort of think about when I bring in Deputy Mayor Bramble, it was really helpful to get the link, Councillor Cockburn, to the air quality map. And it's a comprehensive map of locations. And I know we don't have the air quality team with us today, Sam Kirk and others. Some of the locations that very vividly Claire mentioned, including Dalston Lane, Mossbourne Parkside, as well as Blackstock Road, do have air diffusion tube monitoring. But I think that map is waiting to be updated from a 2020 level, and I just thought it might be helpful to understand when that map is going to be updated, but also, as hinted at, I think, Councillor Cockburn, there are plans for a more sort of interactive map and more real-time data in the future. So it would just be useful to be able to update on that. But Deputy Mayor Bramble.
Thank you, Mayor Glanville, and you're right. Having that interactive live data is critical to this dialogue. And Claire and I have met, and we're in the process of having another meeting where we will have officers from both education and environmental team to meet with Councillor Coburn and I to continue that dialogue. And the whole point of you bringing this here is a really important issue, because actually the reason why the council's taken an approach to build and strengthen healthier neighbourhoods is because we want to have a healthier environment for everyone. And the lower traffic neighbourhoods is a tool that we're using, but we absolutely want to look at the data. We absolutely want to look at how that is working, and the data is critical, and live data is critical as well. And that's why we've absolutely committed to meeting with you again, because the points that you raised are important to us. Thank you, Chair.
Thank you, Chair.
Thanks very much, Deputy Mayor Bramble. I've got Dave, True and Ashman Ali, and then I'll come back to Claire, but then we'll have to close the item as we're already 20 minutes behind. Dave.
Hi, yeah, so I'm from the Land, Water, Air team, so it was just in response to your question, Chair. So thank you for that question about the data. The data for 2020 is on the map. The data because it is based on an annual mean, and the data for December hasn't come in yet. So we need to get the data for December, then calculate the annual mean, but we then have to do a ratification process, which is doing some sort of calculation processes and quality control. So the GLA requires that we submit this in our annual status report, which is due in May. Obviously, as soon as we can do all the QA/QC processes, we can obviously look at updating it, but it does take several months.
Thanks very much, and sorry for not spotting you you were not on my main screen, so apologies. Ashman, you've taken your hand down, is that, or?
Yes, I was just going to, Dave just dealt with that, Chairman, so I was just going to say I'll take that action with regard to the data, but that's been responded to now, so that's why I took my hand down.
Thanks very much. Claire.
Sorry. Okay, I think I've got it now. Okay. In terms of the air quality issue, I mean, again, getting back to my concerns that the areas that we knew already had very high levels of pollution corridors, whatever, and this is from Hackney's own reports, have been the ones that have taken all the extra traffic. And, I know we're going to look at the schools, and we're talking about this, tool of low traffic neighborhoods. I think we have to say it is an unproven, tool. If we look at the experience in Waltham Forest, we find that there hasn't actually been a drop in, people driving, and there has been an increase in pollution. Waltham Forest, which, first had these, in LTN, hasn't been doing very good. And some of the schools there also have very high levels of pollution. And if you walk down or try to walk down Black Horse Road or Hoe Street, I mean, they're absolutely horrific. And that's what bits of Hackney are getting like for those of us who walk. And this whole thing about active travel, people in Hackney have been walking and have been cycling for many years, and increasingly people are finding it more difficult to walk because the streets that we walk on to get to Mare Street, to get, to Ridley Road Market or wherever people shopping on Kingston Road are actually being hammered with traffic. And, it seems very unhealthy out there. Low traffic neighborhoods are healthy for some people, but the impact is the other. And I know from a letter that someone, or an email somebody shared with me from Councillor Coburn, and she was very tearful when she shared it with me. And she felt that the response to her experience as someone on Amherst Road was basically, this is for the greater good, and those of us who live on roads suffering from displacement just don't matter. And that is very, very difficult, especially in areas like Amherst Road and Dalston Lane that have very high density social housing. I know you did some door knocking on Graham Road, and I know you got the opinion of some people there. Certainly, you know, people in Navarino Mansions, people all along Dalston Lane, all the social housing run by various housing associations, all the people are saying to me, the council doesn't care about us. And a large number of those people are people of colour, people from the BAME communities, however we want to phrase it, and they're getting very concerned and they feel that they're being left out of this healthy Hackney, and they're turning around and they're saying healthy for whom? And that to me is very, very sad. I've never seen this in over 40 years of living in Hackney, 36 of them on Dalston Lane. I've never seen the divisions in our community. It's like completely different communities now.
Councillor Cockburn wants to have the final word, which I think is fair. Councillor Cockburn.
Yeah, I mean, look, firstly, just to say to Claire, you know, I did say in my speech as well that, I mean, my response, sorry, that, you know, this is a experimental traffic order. So it means that we've got different schemes that we're trialing. Some of them will work, some of them will require tweaks, and some of them may not work. What we're doing at the moment is what we need to do is we need to be able to look at every scheme on all of those measurements and criteria that I've already mentioned and make a decision per scheme. What we have seen, for example, in Homerton, is we've seen that traffic both inside the LTN and on the boundary road, so not just inside the LTN, is down, and that's a 5% down on the boundary roads and over 30% on the internally within the LTN. When you look at Hoxton West, for example, which we've recently just published as well, again, it's over 40% down, 46% actually is to be quite precise with inside the LTN, but then also 18% down on the boundary road. So these are sort of the roads that surround it. And what we're doing is part of that, when we are putting this out publicly, we're specifically naming the streets and what those percentages are. Now, there will be some displacement, and we know that that will happen. And what we're looking to do with the team, from the transport team, is making sure that we're able to mitigate some of these problems that we are facing. You've mentioned Amherst Road, and that's actually where I'm brought up and where my parents live. And just to be quite transparent here as well, I also live on another major road, which is Green Lanes as well. So these are roads, arguably, which, you know, based on Claire's claims, would be most disproportionately impacted. And those aren't sort of the real experiences of the people that we are speaking to. And, you know, to be quite frank as well, you know, I don't accept the claim I think minority communities are disproportionately impacted. Actually, when you look at studies by the recent Guardian article, which showed that more people who live within low traffic neighbourhood schemes are more likely to be from deprived backgrounds. And it's not fair on those kids who have to grow up with stunted lungs or with asthma or the associated health risk because their council is choosing to not do nothing about it. So look, we're not going to get it always right. No one's ever said that. What we have committed to do is we have committed to take action on air quality. And as part of that process, the low traffic neighbourhood schemes is one of that. The school streets is also something we're doing. We've launched 48 of those. And already when you look at the impact of school streets, tailpipe emissions outside school gates are down by 48%. 30% more children are now walking to school, and more than 51% children are cycling to school. Cycling is gone the highest ever it has been in Hackney, which shows that, again, low traffic neighbourhood.
Councillor Cockburn, sorry, I'll ask you to draw to a close if that's okay.
Of course, yeah. Sorry, Chair, I can go on and on and on.
I know.
I just wanted to thank Claire, and I look forward to continue discussing this conversation with her further.
Yeah, and I know Councillor Cockburn and Deputy Mayor Bramble and myself will make a committee to that meeting that was talked about earlier. I think as we draw the item to a close, obviously the discussion and the response will be in the minutes. I think it's probably for Mark and I, with Health and Wellbeing Board colleagues between meetings, to sort of build on what Councillor Cockburn has said and what I think Dave said, and think about how given the prioritisation around air quality and the link into public health, how the Health and Wellbeing Board wants to sort of take forward some of those annual reports and discussions, because I know we've had some of the active travel work here beforehand during policy development, and there is a commitment to sort of look at all of our green and environmental policies at a future Health and Wellbeing Board, and all of these issues are key determinants of health for the reasons that have been discussed in the debate. So I think we should return to this issue at a future meeting and build it into our work programme. But we are now half an hour over where we should be. So if I draw the item to a close, you're more than welcome to say, Claire, we've got a small gathering, but thank you very much indeed for coming today. A really important contribution, and to officer and councillor colleagues that have spoken. I think we can have a brief update on the current COVID situation if Sandra and the team are able.
Yes, thank you, Meg Lanville. I'm not sure if I'm confused though, because I think we might have missed item 7, which was the membership update. Unless I just sort of blanked out for a few minutes, I don't recall us doing that one. I'm happy to do the COVID update now, and you can return to that, and I'll try and make up some time. So I'm just going to share
Sorry, you're right. Apologies for that. It's in one set of my notes, but not in the other. So that's why I skipped over it. So we've got, as you've rightly said, the Health and Wellbeing Board membership changes. There's a paper attached, item 7, with the proposed changes to the membership. 2 additional members have been proposed in order to increase representation from the voluntary and community sector. That's been through discussions, I think, with HCVS and others, and the board is asked to appoint Francis Haste and Susan Masters as additional representatives of the community and voluntary sector on the Hackney Health and Wellbeing Board from March 2022 onwards. Obviously, Susan's here. I can see her on screen. Francis might be here as well. Yes, she is. I can see her. And they're observing today, but as full members, and they would join Rosemary, who has sent her apologies to this meeting. I think it's about some resilience and broadening the shoulders of the contributions, and I know that's also been discussed. So if we can just quickly agree that, and thank you, Sandra, for keeping us on track, I'd be grateful. Are we agreed? Agreed. And due to London Borough Fire changes, we're still not quite there yet on the Borough Fire Commander. I had a very lengthy meeting with what I thought was going to be our Borough Fire Commander, and he swiftly moved on. So I'm just starting that process again and getting the letters, but hopefully we'll have that all ready for the March meeting, at least in terms of observer status, if not full membership. Thanks, everyone. Moving on, and we should have done that before Claire, actually, but I was eager to make sure that Claire had her contribution and could leave or stay as she wanted. Sandra, COVID update.
Yes, thanks very much, Meg Lanville. So there's some goodish news over the past couple of weeks that we've seen some decreases in the case rates. They are still pretty astronomical, but we're still seeing fewer cases locally and across London, and there was a decrease in the national case rates in the most recent complete week of data we had at the time that these figures were compiled, which was the week up to the 18th of January. The national figures looked like they were also declining. And just to give you a little bit more detail on that, the case rate for Hackney in that week was 706 cases per 100,000 population, and that's a decrease of nearly a third from the previous week. And most wards were recording case incidence rate of less than 500 cases per 100,000 population, and there was only one ward that was above that level. PCR testing positivity rates have also decreased, but continue to be high, so that it was around 20% in the week to the 13th of January, but and that's down from 26%. And lateral flow test positivity rates of tests reported was around 6%, not really a significant change from the previous week. One of the things to bear in mind, of course, is that period up to the 18th of January represented the period in which testing capacity was squeezed, and so we know that we saw a reduction in testing as well as in the positivity numbers. So some of that will be a reflection of people not getting tested, but the fact that the positivity rate is coming down as well is a reasonable indication that infection transmission is slowing down. I'm just going to show you the dashboard just so you can see what it looks like. And as you can see, that was the latest week up to the 18th of January. So come down significantly from that very high peak just before Christmas, and seems to be stabilized. Numbers seem to be stabilizing at the moment, and in every age group, the case rates have come down except for primary school age children, and we know that there are continuing to be situations and outbreaks in schools, actually both secondary as well as primary schools and early year settings, and we're working with education colleagues on that. And then the other thing I wanted to tell you, I'll stop sharing that, is about the vaccination uptake. So as of the 22nd of January, we'd achieved vaccine coverage of 64% of the population aged 12 and over. And that's in terms of the first dose. 58% had also received a second, and 36% had received a third dose or booster. So we are slowly building on vaccine coverage to get people as completely protected as they can be. What we're doing now as a health protection system locally, now that there are very few regulations left from a national perspective, and the government's approach is to ask people to use their own judgment. We're working on how we support people to do that, and also how we gear up for the potential for all measures ending, including possibly self-isolation for people who are infected, ending later in the year.
Thanks, Sandra. Did you finish? Sorry, it felt like it had cut out and
Oh
you
yeah, no,
stopped.
sorry. I said I just was saying that's the last thing I was telling you, is that's what we're doing now, is we're working on what the next steps will be. But I couldn't tell you what that is yet.
Thank you, Sandra. Thank colleagues who were part of the public statement yesterday. Councillor Kennedy, myself, and Sandra were working on that as a very precautionary response to the change in restrictions today. Obviously, the context very clearly set out by Sandra there and the team who support her. Obviously, that is a public dashboard that's available. I know that Health Watch wants to touch on elements of COVID response as well. So just to ensure that we do get through this agenda, and I'm not sacked as co-chair, given we're an hour in. Are we happy and content with that update? And I'm assuming we can move on without any questions at this stage. Not seeing anything, so that's brilliant. Thank you for that update. The next item is the Health Watch Hackney question. Just for context of people watching at home and colleagues on the Health and Wellbeing Board that may not have been copied into all of the emails, Malcolm Alexander sent a very comprehensive letter to the co-chairs, I think, of the Hackney Health and Wellbeing Board on the issue of older people and their support at this stage of the pandemic. That was received on the 17th of January. It had 14 questions related specifically to kind of this point in the pandemic and some of the work of vaccine and guidance. Public Health and NHS colleagues have written a comprehensive response to Health Watch with a full answer to those questions. That comprehensive response will also obviously end up in the public minutes. I know that only went out, I think, earlier in the week. So I just wanted to provide that context. It was useful exercise, I think, and hopefully help shape this discussion. I wanted to sort of hand over to Malcolm so that they could answer any follow-up questions. And as I say, the comprehensive sort of response, I think, went out maybe yesterday. Yeah. But I think there's some learning for all of us on that. But I think in a relatively short space of time, and if you think of sort of standard complaints or responses, I think, we did get a written letter back, and I hope hopefully it helps both the letter and the response to shape this discussion. Over to you, Malcolm.
Thank you very much, Mayor. Yes, the responses were very full and were very fast, so very grateful for that. I suppose as the government's focus on protection wanes, we're very concerned about vulnerable groups, and two of the vulnerable groups we're concerned about particularly are the over 60s and people who are immunosuppressed. We keep on hearing now about sort of COVID is just a cough. That seems to be a sort of something that is repeated so frequently. Yet we know there are very severe consequences of COVID amongst parts of the population. I know that Chris Lovett has made some comments about the issues about people over 60, and I think we need to sort of look at those in more detail. We certainly need more data about the impact on older people and people with comorbidities. What we do know is a lot of older people have chosen to, perhaps following government guidance in the first instance, have chosen to lock themselves away in order to protect themselves, and this is having quite a severe impact on some people's mental health. I mean, one of the things we really thinking about, and it relates to what Sandra has just now said, is about the council providing the right advice for the over 60s. For example, about the wearing of masks, and the government have been clear, I suppose, about masks being a good thing to use, but they have slackened their approach so much. They've more or less sort of said, well, the over 60s should, and people who are vulnerable should follow the same guidance as everybody else, and that's enough. And it clearly isn't enough, because the COVID is going to continue to impact on people very severely in the future. I mean, one of the things in one of the answers to questions we put to you, there was some details about the right kind of mask to wear. But, that is a problem, because, of course, people don't necessarily have access to those very particular masks which will protect them. And putting continual emphasis on the importance of wearing masks and keeping proper distance is so important. But things are becoming very lax now, and people are thinking that those precautions are no longer important, as if the virus has gone forever. So, I mean, one of the things we're really asking is can we work together to produce effective guidance for people locally, especially for older, vulnerable and vulnerable people and people with comorbidities, because they're the people who really are at risk of death. And it's very important that although the government is sort of saying, follow the same guidance as everybody else, there isn't that same sort of sense that people have of the danger, which is clearly there. We also need to look at the impact of long COVID, and I think very little it seems to be said about the impact of long COVID, and that's really of fundamental importance. And it is of particular importance on older people, because if they have long COVID and they're living alone, they're in a very difficult situation, and the impact on them is really so much greater. We also were rather disappointed there wasn't more data about the impact in relation to people ended up in ICU. We don't seem to have data on age or ethnicity of those who find themselves in the intensive care units of our hospitals. The situation regarding the ambulance service is absolutely appalling, with many people waiting long hours for ambulances and also long hours in ambulances queuing outside A&E departments. And I think it would be useful for the data about our local hospitals to be available in one of our meetings here. The campaign against vaccinations by health service staff, some health service staff, is something which is really worrying. And one of the impacts we're really worried about is what happens to, for example, community staff who are supporting the needs of older people if they're not vaccinated and they find themselves moved into different jobs or different positions. And that again could have a very severe impact. I mean, just lastly, just to ask a question really, which is, how prepared are we for the impact of another wave of the virus, because undoubtedly there are mutations which are coming along. I mean, they're being obviously very carefully recorded by the World Health Organization, but they will hit us eventually. And I think it's really important that we're ready for any sort of future situations where we have a mutation which is going to be very harmful and is going to spread very quickly, like the Omicron variant. And just lastly, perhaps a question that Sandra might like to respond to, which is the question about second boosters. And really the question is to understand why we're not moving into a situation where we're ready or able to give second boosters to the population which is most vulnerable to infection from COVID. So thank you very much.
Thank you, Malcolm. A lot in there and a lot to unpack. I think some of the answers to the board statement are in the statements that were sort of issued yesterday by Sandra and myself. I think we're all really clear, and I will hand over to Sandra. I'm not going to attempt to be either a medical or public health professional or some hybrid combination of both, but very clearly state that it is not just a cough. Sometimes it isn't even a cough in itself, and I think we're very aware of the impacts, and especially the impacts on the most vulnerable. And as I said in opening, I think a really precautionary approach that we are taking. I think some of the answers are actually sort of in the response, especially your final question about the booster program. I think we do have to be sort of clear, and maybe Sandra will go into that, where that that is the sort of top down in terms of the categories around the vaccination program. But Sandra, I think you might be better placed to respond to the rest of Malcolm's questions.
Thank you, Meg Lanville. And I am a medical public health professional. That's not a hybrid, that's a real thing. But anyhow, thank you, Malcolm, for those questions and for the opportunity, actually, because I think there's some important points in there to get across. And I welcome the offer of help from Health Watch with our framing our messaging and making sure that it's getting out to particularly vulnerable people with long-term conditions and older people. We have been continually trying to convey the message to people that they need to do everything they can to protect themselves, but also to protect each other. So all of the steps that we take to prevent transmission of infection are both about self-preservation, but as well as protecting other people, including vaccination, which is the single most important thing. And on that point, about why are we not moving to a second booster dose, the fact is that we don't know yet whether it's going to be necessary or appropriate to do so. And so that's something that's under constant review by the JCVI scientists and other people who are better qualified than us to make a determination about that. But the other thing that I think is really important for us to consider, although we can't necessarily do anything about it at local level, is that the only way for us all to get out of this pandemic, to get to a point where SARS-CoV-2, the COVID virus, is at endemic levels, whatever that might mean, but meaning that whatever level that is, so it could be at a high level or a very low level if we're lucky, but where the rate of transmission doesn't continue to grow in various places, but we may end up having occasional spikes or epidemic spikes in places which are just going to be much easier to deal with, and therefore won't necessitate national lockdowns and severe measures like that have other impacts, negative impacts for people besides the positive impact of curtailing transmission of the virus. The only way we're going to get to that level, though, is when this is dealt with at a global level, and that will include things like, the primary thing would be vaccine equity. So I'd actually be a bit concerned about us saying we need second boosters for people in this country, when in fact, as you quite rightly said, there could be another variant arising anywhere in the world where there are high rates of transmission, and therefore the conditions are right for a new mutation that takes hold to arise. And as we've seen with the Omicron variant, being vaccinated didn't necessarily protect us fully against that, and having another booster wouldn't necessarily protect us from another one in future. What we really need to do is try to keep a lid on the transmission at a global level. And of course, at a local level, we want to keep a lid on transmission as well. And that's why we continue to advocate for all of the measures, including wearing face masks. Now, the detailed information I put in the written answer about face masks was to respond to the specific question about why we are or are not advising people to have the higher grade, higher filtration masks. And you're absolutely right, they're not easy to come by, but they're also kind of pointless. They're expensive. You can buy them. You can, go online on sites and buy them, but they're expensive. And of course, because they're disposable, that's an ongoing expense for people. But they also don't work if they're not properly fitted. So I actually wouldn't think it was ethical for me to advise people to buy these high-grade, expensive masks that then weren't going to afford them proper protection because they weren't wearing them properly. The best way we get protection from masks is when everybody wears them.
Mm-hmm.
And I think I might have answered all of your questions, but please remind me if there's another one that I missed.
No, I think you have answered all of them. Thank you. Oh yes, there's one. One question, and that is, apart from people who have not been vaccinated, we don't seem to have any data about who's ending up in intensive care units by age or immunosuppressed state.
Yeah, so we do know. We don't know who those people are, but we do know that the people in the hospital know who they are. So it's just a question of finding a way to extract those data and do some analysis on it. But it's not that nobody's looking or nobody's collecting it and nobody understands it. And we are in constant conversation with hospital colleagues. But one of the things that's difficult when you're working at this sort of and under the sort of pressure that they are, is to take the time just to do the data extraction to provide it to people like us.
Okay, thank you very much. Thank you, Mayor.
Thank you. I think Mark wanted to just come in briefly, and I think you've both welcomed and agreed that there's some sort of further engagement and work to do, probably offline with Health Watch, which I think is great coming out of this question. Mark.
Thanks. I was just going to say about just a little bit more about the masks and what it means to be properly fitted, because I think probably most people wouldn't necessarily know quite how technical that is. So to have what we mean by properly fitted high-grade mask is currently clinicians and carers in the community have to go to the Homerton Hospital and have a fit test to have your mask properly fitted. That involves, it took me, 20 minutes or more to be tried out with different masks to get the one that worked. This is when I was doing some sort of volunteering in the hospital wards at the height of the pandemic. And once they're fitted, they are solidly around your face and you're breathing through a little valve, and it's hard work. It's not nice at all. And certainly, I think there'll be a temptation where we worry that people are struggling to breathe through that little valve might go, crikey, this is not what I want to be wearing for the next 2 hours, and then risk not wearing it at all. That's even if they've had access to a proper fitting, because if it's not fitted, you've got air leaking out the sides like you have with an ordinary mask. So actually wearing an ordinary mask well, actually you can get quite a good fit around it because you put it right over your nose and you pinch down that metal. Actually works well. So properly fitted other high-grade masks isn't just a quick, easy thing. And it's not an easy and pleasant thing to be wearing for long periods of time once you do have a fitted mask. And I know people who stopped opening windows because they said, oh, I'm now consulting in my room, I don't need to worry, I've got a fitted mask on. Well, actually, no, it's probably, you probably do need to keep that window open, actually, because actually ventilation is highly effective, et cetera, et cetera, et cetera. So there are lots of unforeseen consequences of high-grade masks which aren't properly fitted. And actually, let's just make sure people wear these things when they're in close contact and continue the precautionary approach of distance and ventilation and all those other usual measures that we talk about all the time, because they really do help.
Thank you.
Thanks, Mark. I think that was incredibly useful in terms of the building blocks to reducing risk, and also the collective steps we can all individually take to help with that effort. So thank you to Malcolm and Health Watch for that item. I think it brought to life both items very much indeed. and thank colleagues for those comprehensive responses. Item 12 is item 11 is the health and wellbeing strategy update from Donna. I'll hand it to you.
Thanks, Mayor Glanville. I'm just going to give you a really quick update on where we are with the Hackney's health and wellbeing strategy. Just because there's a couple of people in the hall who might not have the background, we've been developing our health and wellbeing strategy refresh, and every local health and wellbeing board has a duty to produce a health and wellbeing strategy, and that outlines our key health and wellbeing priority areas for Hackney over the next 4 years. This board has agreed that we will have a focus on reducing health inequalities within that strategy as well. So for context as well, at the last Health and Wellbeing Board meeting in November, the board approved the draft strategy for formal consultation, and that was published then after the board meeting on the 25th of November. So we're now in the 12-week consultation phase. And things have been going pretty well. I think when I looked today, there was 115 responses online. We've sent out about 100 paper copies, and we've attended 31 meetings so far with about 220 stakeholders. And we've got support from Volunteer Centre Hackney and residents in cascading the word further, and they're doing a number of resident drop-ins this week. To sheltered housing, the Round Chapel, some of the food banks, and Curve Garden as well. So we've got 3 weeks left, and generally the responses back obviously haven't been analysed yet, but from a quick look seem pretty supportive of the 3 priority areas, which is great. So we'll have to do a bit of work after the consultation ends to understand what residents and stakeholders are telling us are important actions underneath each of those 3 priorities, which are mental health, social connection, and financial security. So we're pushing ahead with communications and engagement over the next 3 weeks. We still plan to close consultation on the 17th of February. And you'll see within the paper attached in the agenda pack the meetings that we've attended so far as well, and what we're doing around accessibility as well. And whenever this paper was written and sent for publication, the agreed next steps would be that the final strategy would come back to the March 2022 meeting, so the next one. But we've since had a conversation with both the chairs of the Health and Wellbeing Board and decided that we will use the second half of I guess if the board is in agreement, we'll use the second half of the March meeting to bring the strategy back, bring the consultation responses back as well, and consider our action planning and partnership approach for next steps with that strategy, but still working towards the same timeline of having a launch for the strategy and the action plan in the summertime of 2022. So I guess when we come back after the election period. So that was a really quick update. I don't want to take up too much time because I know that we're running behind already, but happy to answer any questions anybody has on that.
Thanks, Donna. And just to build on that, I think what would be really, really great is in the sort of using that March moment to make sure that the organisations and sort of sectors represented here have used that insight and that stage of the report construction and to sort of take it home, check it, and so that they can contribute and are basically giving it that sort of clean bill of health to go through that further stage. And I think there's a lot of people from the council here on the in the meeting, and I think it's important that we sort of take it back and see what we think as a council, so that when we come to the board, we've got that sense of the parts of the council are content and reflecting on what residents and organisations are sort of saying. Because I want it to be a really collective, I think we all want it to be a health and wellbeing document, but that does require that kind of, this isn't a council meeting in that sense. It's obviously hosted by the council, but it's broader than that. And I want to make sure it feels really collective when we do those final stages. I think no one's got a hand. Has anyone got any other sort of questions or comments? Are there any gaps, just before I bring in Councillor Kennedy, Donna, is there any gaps? Is there anyone on this call that you would like to meet outside of the meeting or or organise anything with, just to sort of use the opportunity of these very senior borough stakeholders. While you think about that, I'll bring in Councillor Kennedy.
Thank you. 2 quick points. I think the response rate is good, but we want it to be better. So all of us share the consultation, the draft consultation on asking those basic questions. Have we got it right? Broadly with partners and within our organisations. And the second point goes back to what we were talking about earlier, and you were talking about, Chair, in terms of our mental health priority that's emerging from that, and that is being talked about very widely and across the system, linking back in to the JSNA. And if we are talking about prioritising areas where we want to get our data strong and solid so that we can plan actions, I'm definitely suggesting that we prioritise mental health, understanding exactly where we're at, so that when we approve this strategy, we hit the ground running. Thank you.
Thank you. Very powerfully said and very live to the meeting we were at together earlier in the week. I think also there's the grants program that we're running based, I forget the technical term. Yes, that. And then we've got obviously the work from the Concordat. We've got various community-based organisations, one wanting mental health, and Dama, it's very familiar to all of us. You know, we need to make sure that we're not reinventing the wheel and that we're building on that really strong foundation with the work. I think we talked about that before. Final comment to you, Donna. I know there's something in the chat really welcome from Susan about some of the discussions coming out of the Assembly from earlier today. Donna.
To answer your question around gaps, I think what the focus for us, and who we haven't heard a lot from, we haven't heard very much from our Asian communities, we haven't heard a lot from the Orthodox Jewish communities, and the people that we have heard from so far are above the age of 23, 24, so we need to have a bit more of a focus on young people as well. Trying to think if there's any other gaps. We have yet to have a conversation with the fire brigade as well, so that's the sort of areas of focus over the next 3 weeks.
Thank you. And I know the action plan isn't there because we're not at that stage. There's something about the action plan and us collectively signing up to it and knowing what our respective hats and organisations are agreeing to as the action plan comes out of the strategy, because otherwise it's a strategy that sits on a website and in a desk drawer, and we're not clear who's delivering what. So I think that's just I'm going to be quite tough on that stage of the process in March, and if we're elected afterwards. But I think it's really, really important that we do that as we've sort of recast this Health and Wellbeing Board around this strategy and that wonderful engagement, Donna. And I've seen the posters up. I've seen I think in a community pharmacy in Hoxton, I saw some engagement. You know, this is certainly the most comprehensive engagement we've had around a document like this in my sort of memory. So thank you, and really welcome the work that you've done to lead it with colleagues. I think that gives you everything that you need from my notes and our discussion. So thanks. We'll move on to item 12, which is Director of Public Health report, which Chris is going to lead. It's a brief update on the plans for the Annual Director of Public Health Report 2021-22, and the board is asked to note and flag any questions. Over to you, Chris.
So very briefly, just so we can recover a little bit of time. This was due to come to today. Omicron did delay our ability to work on the Director of Public Health report. So we are planning to produce it in April, so long as we don't end up with any further outbreaks, large outbreaks or new variants. So it's going to be focusing on children and COVID-19. There's been a lot of work already done on this in the needs assessment for recommissioning of children's services. And obviously this is an area that we're particularly focused on, is the impact of COVID on children. So yes, this is a note to say that we won't be able to publish it this time, but it will be coming in April.
Thanks very much, Chris. Any comments or questions? Anything you would like while you've got senior stakeholders in front of you, Chris? Okay, I'm going to catch up then, and thanks very much indeed for that update. We're happy to note the plans for the report. Noted, great. Item 13 is the Synergy Pledge Programme update, a real example of some of the building blocks of the work that we're doing around mental health. So I'll hand over to Andrew.
Yes, thank you, Chair. I should say at the offset, it does appear as though the appendix has not been made available, which is the full version of the report, which Fawzia backed, submitted in November. However, it's not a disaster, as the report that people do have access to acts as just an abbreviated summary of what is in that report. So I defer to governance on how to make the full report accessible to everybody, and I would encourage everyone to read it should any of these top line comments, if you're looking for more depth on anything that's mentioned. I don't have anything verbally to add to what I've written, but what I did want to do is to just ensure that the board, as a signatory to the pledge, is kept up to date with the activity that's ongoing, and the twice annual reporting that we're doing, I think, should come to the board for review. And this should be a place where members have an opportunity to engage, to advise on areas which we should be focusing on for future reports. And I would encourage everyone to contact myself, Fawzia Bakht, or Rhiannon England, who does join us today, if they would like to become more engaged in this, or if they have any issues that they would like us to follow up on in greater depth. I am happy to answer any questions. I know we're still a little short of time, but for today, if anybody has any issues that they would like to bring to our attention that we can ensure are incorporated into the next report, that's gratefully received. Happy to receive that afterwards. Myself and Rhiannon are here today to answer anything else.
Thanks, Andrew, and apologies we haven't got the full document in front of us in the way that you were expecting. I think as I sort of hinted, it's a really important sort of building block, an indication of our commitment around mental health. I'm quite interested in the overlap between kind of some of the work that's being, and Thrive's obviously referenced in here, but the work that Thrive is doing, the kind of historic and really welcome contribution that ELF has made around disproportionality and health inequalities, especially around mental health. And I suppose how that all sort of links together, and where we might go next, building out of the strategy. The last bit I'd say before bringing in colleagues, I think in 2.9 pledge commitment 3, I'm really interested when we're talking about health inequality and this post-COVID moment coming out of COVID, reducing health inequalities and disparities, that it isn't just sort of geography or lifting all outcomes, that we close the gaps that exist. And there's some really good gaps there around IAPT access, some of the things that have come out of our work working with young Black men around community trauma, approach to mental health services, outcomes, as well as access and confidence, trust and confidence in the reality in the health system from some communities. We also know different communities access mental health services in different ways as well, and have different degrees of ability to access services outside of the NHS and within. So I really think actually this document has a huge contribution to make to sort of where we go next in this work. And I just, there's 15 minutes allocated, but how we get involved in it and how we make it much more part of what we're doing, I think is really important, certainly to me. I don't know what colleagues think, especially health partners. And I know Deputy Mayor Bramble wants to come in because I saw a hand go up. I'll bring in Deputy Mayor Bramble and then look for other hands. And if not, I'll come back to Andrew. But just thank you again. And also thank you when we were at the sign-off stage for being so available to sort of discuss and brief as we signed up. And I know that there's a hand of Councillor Kennedy there as well.
Thank you, Chair. I mean, trauma-based practice is something that we're talking about more and more in children's social care. I know I've spoken about it with Diane and Jackie. It's hard to keep track. I can see you on screen, the amount of conversations we have, but I'm sure we've discussed that in great detail as well. Just around health inequalities, I think the council as a whole, with its commitment into improving young black men, has really moved forward. But we really want to move away from myself as an individual being an advocate and Sonia. And one of the ways is that ensuring that as every part of the council that we discuss it, that piece of work is embedded in segues in the partnerships that we have. Councillor Kennedy and I have had a detailed conversation about this recently, actually. And I said to officers, well, we should have an equivalent of Black 5. And actually, you know, officers, they said, well, Hackney doesn't have to do what they do. But what I wasn't clear is what our offer was. I do believe that we have something in train now, but I really think it would help if this board had it reporting into, and it really understands the impact and the footfall that we're reaching those young black men, that we understand, you know, define all the myths. Oh, young black men don't like to talk. Talk therapy won't work. All of those kind of myths, I think the board has the opportunity to explore and define that. And that learning we can then use as a broader approach around the commitment that we have in improving young black men. And one of the things that I would say around this is going back to trauma-based practice. Why it's so important is that I'm also concerned about delayed trauma as well. I think a lot of time you're sort of in process mode, and also in some communities not talking about it is the way to go forward, or not feeling comfortable to go forward. So it's really important that we understand those nuances and begin to explore this. This is why this work is so important. Thank you, Chair.
Thanks, Deputy Member Bramble. I will take Mark.
Oh, thank you. I wasn't sure from, and I guess I know we've only got the sort of summary high-level report, was around the sort of some of the issues around domestic violence, and another example of a group of people who could be difficult to see in the community. And I know how that the consequences of different sort of cultural backgrounds, etc., etc. And I just wondered what work was going on currently in that place. And whether that was an opportunity to do something more differently in the future. To ask your final question about what differences, what different approaches you could adopt.
Thanks, Mark. I think the fund that Chris and I were trying to, it's a Better Mental Health Fund, isn't it? Yeah. Just for the clarity of people watching, I concur with, I think, what's been said in the chamber, and I think I would be interested in further sort of health colleagues before I bring in Andrew finally, is we're thinking about how the ICS is forming, and we went to that session with mental health champions and cabinet leads led by London Council about how to work with the ICS. If we become a discussion about health recovery and volume, a lot of this level will be, and community collaboration will be lost. I think the fact that we have this here in Hackney and a structure to take forward this work is really, really powerful. We will, though, and I know Rhiannon's been a part of this work and is really committed to it, and I know Mark is, but we need to stay focused on it as the world changes around us. I'm really looking forward to also the discussions at clinical level with ELF that Chris and I are going to have around some of the changes there. Anyway, over to you, Andrew.
Yes, thank you. I've made some notes, and we'll take all of those comments on board, and that can all go towards informing the next report. Just to come back to the Pledge Commitment 3 and the Better Mental Health Fund, I think that it's a great opportunity to build on what we already have. We're currently in a second phase of recruiting community organisations, which will hopefully expand the reach to groups who remain sadly underserved. And that second phase of recruitment is happening at the moment, but we've already got a number of organisations delivering at the moment. We've got Hackney Chinese Community Services, Coffee Afrique, Swim, all able to do a range of quite innovative interventions, which is something we wouldn't until recently have had the ability to offer. I would like to give Rhiannon an opportunity to speak if she has anything to add, because ultimately, I'd like to think I've been more than a plucky sidekick in this effort, but ultimately it has been Fozia and Rhiannon who have spearheaded this and took the initiative to get the signatories from both the Health and Wellbeing boards. So Rhiannon?
Yeah, I've not got much more to say really, apart from thank you for all the comments, because I think they're really valuable. I think that, you know, this is a work in progress. I think it's really important from a health perspective, to remain very focused on making mental health services accessible in whatever form that takes. And I think that sometimes takes a bit of a leap out of the box, and I think we've done that to start with. Is a huge journey more to go on, and you know, there's a lot more to do, but it does feel like we can start to look now within the constraints, obviously, that from a health perspective we have in terms of reporting back to NHS England, etc. But everyone is so committed to this work, so it's fantastic, and we're one of the few areas where the local authority, London Borough of Hackney City, and the CCG has signed up as a system. So in other places, it's been one local authority or a CCG. So I think it's really powerful. And yeah, we're just going to keep working. So please, feedback, suggestions, comments. You know, we need to be thinking about our next report. So we'd welcome all of that and those conversations at higher level about how we fund together services going forward. Thanks.
Thanks. I just conclude my thoughts on saying that I think that prior to the pledge, there was already some very good work going on, and you know, it's important to recognise that and not pretend that the pledge is doing more than it can. But what the pledge, I think, is really important for, and it's already delivering, is enabling us to network and coordinate more as a system on this. And that's difficult, as we all know, but that's already started, and we're looking for opportunities to share good practice and develop that community of work.
Thanks very much, Andrew and Rhiannon. Final comments, please do make use of Councillor Lynch as mental health champion, Councillor Kennedy, Deputy Mayor Bramble, probably not myself realistically in sort of seeing the projects. I'm familiar with some of them and they're absolutely brilliant. And I've also really enjoyed some of the community conversations we've had and the link into Thrive London. And it's great when you see these projects on the ground. My sort of final comment is, I've been at some of the assembly events and some of the consultation workshops and discussions around the Health and Wellbeing Board strategy, and it is clear mental health and wellbeing is a massive priority for the people of Hackney and the anchor institutions. That's clear. That's why we're putting it in the strategy. We've got a lot in here. How do we link the two together, and how do we start to convince the people of Hackney and their voluntary sector organisations and representatives that we are delivering that change and we are investing in the things that, because it is here and it feels really powerfully here, there's strong commitment on the call. And maybe in the biannual next update, we pick a case study or something that as well sort of brings it alive, so that we link that work with the community, because I think we've done that very successfully with some of the champions' work about a broader agenda. But thank you so much, and I'm really pleased it's coming here and there's such high level support. While you've been speaking, I think we need to move on, Deputy Mayor Bramble, if that's okay. While you've been speaking, I've been really enjoying watching Connect Hackney get ready for their contribution to the meeting. I can see a lot of excitement and energy on Dalston Lane, and some incredible people who I know are offline. Really welcome Judy and HCVS and Connect Hackney to the meeting. And I will hand over to all of you to talk about the evaluation, and I think where we go next. There's 14 recommendations that you're going to bring alive for us, and I look forward to the discussion. Over to you.
Great, thanks so much. So the older people are just going to say a few words, and then Angela Harden will present the findings, and then just got a few more words to say after her presentation, and then we'll have questions. Thank you very much. Okay, over to our older people.
Hi. Thanks for having us. Please let us know if you can hear us, okay? We are from
We definitely can.
Program, Older People Committee. The program began in 2015 and is funded by the National Lottery Community Fund. It focuses on reducing the social isolation of older people.
Our mission is to tackle social inequality and drive beneficial social change in the lives of older people. Priorities I feel we share with the Health and Wellbeing Board, especially in the area of mental health and social connectedness.
The program was evaluated by City University. The evaluation produced a quantitative impact report and a qualitative report on topics including engaging men and digital inclusion. The recommendations based on these reports have been sent to you in the Health and Wellbeing template. Today, we will be presenting the findings from the program Reach and Impact Report. Angela Harding, Professor of Health and Science at City University, is here to present the findings. And over to you, Angela.
Many thanks, Antonia. I don't know whether my presentation can be shared with
Yeah, I can share that 1 second.
Thank you very much. And I should say, so the Older People's Committee have been a real driving force in the programme. They've helped to commission projects and they've also helped massively with the evaluation too. And so they're a real asset to Hackney. And we're hoping they'll continue to be active in their role. So I'm just going to give you a bit of a whirlwind tour between the main findings of the evaluation, which lead into the recommendation that Hackney CVS has presented the board with. I could have the next slide, please. So Connect Hackney is part of a national programme that's been running across England, funded by the National Lottery Community Fund, which has really tried to promote social contact amongst older people with a view to reducing isolation, loneliness, and promoting health and well-being. And Connect Hackney is a suite of community-based projects which provided a range of opportunities for older people to connect with other older people and with their communities. This was combined with practical and emotional support and skill development. So, for example, digital inclusion. As Antonia has said, we've collected qualitative and quantitative data, and the quantitative data consisted of a large baseline questionnaire with some follow-up data. Now, this was cut short by COVID, so we don't have as much follow-up data as we'd anticipated. But together with the national data, there's a very large data set to show the impact of the programme. Could I have the next slide, please? So just in terms of, I wanted to show you the reach of the programme. This is a very busy slide. I don't expect you to take everything in. But what I really want to show is the fact that Connect Hackney managed to engage diverse groups of older people. And I've compared it here to participants in the Ageing Better programme overall across England, to local data when available, and to national data. So you can see there the programme attracted participants from both men and women, although, as we know, a lot of social programmes tend to attract more women, but Connect Hackney actually did better than Ageing Better nationally because it had programmes specifically targeting men. The programme attracted a wide range of ages, wide range of ethnicities, different people identifying with different sexualities. Next slide, please. The programme also attracted those older people who we know are more at risk of loneliness and social isolation. So participants who were living alone, participants who were carers, and participants reporting a long-standing illness or disability. So the programme had quite deep engagement with groups who are more likely to be experiencing health conditions and more likely to be lonely, socially isolated. Next slide, please. So this shows, could you also click again? I've just got another, thank you. So this shows loneliness levels by age, and if you look at the first two bars, amongst all of the participants in Connect Hackney, about half and half were lonely at the start of the programme, and half were considered to be not lonely or at risk of loneliness. And you can see there, compared to residents in Hackney overall, so the national evaluators actually did a study in Hackney to look at levels of loneliness, and overall, there were 20% of Hackney residents were classified as lonely. So you can see here the participants in Connect Hackney, we attracted a much larger rate of people who were lonely. So really, the programme really targeted, was able to engage those most in need. So next slide, please. And what we also saw, as in line with lots of literature which demonstrates that loneliness and social isolation is a key determinant of health, we can see that lonely participants rated their health much worse than those who were considered to be not lonely or at risk. Next slide, please. So coming on to programme impact, what we found was statistically significant improvements from programme entry on 5 key outcomes. So loneliness, the key one, health-related quality of life, self-reported health, well-being, and a measure of social contact, so engagement in social activities compared with others. And I'm not going to go into detail for all of these measures. I'm just going to demonstrate our findings on a couple of these. So the next slide, please. So in terms of impact on loneliness, there was a 12% reduction in the proportion of participants classified as lonely at baseline compared to follow-ups. So we can see there, even though at follow-up there was still double the amount of participants who felt lonely, we can see it did move closer to the levels in older Hackney residents in general. And this 12% overall reduction translates to 22% of the participants being lifted out of loneliness. So if you move to the next slide, I can show you that. So this shows you those lifted out of loneliness, those with no change, and those who became lonely. And what this illustrates, that the whole programme was a test and learn programme to see what worked. So the programme has learnt many lessons along the way and has got several factors associated with the success for these 22% lifted out of loneliness. And what it shows is that the programme might work in different ways for different people, and we need to get much better at identifying what works best for whom. But if you move on to the next slide, so this is impact on mental well-being, and of course low mental well-being puts people at higher risk of depression, but also we know it's associated with poorer health as well. So you can see there that the programme also had an impact on mental well-being, with a 16% reduction in the participant proportion of participants classified with low mental well-being. Move on to the next slide. Just a last example of the impact is self-reported health. So you can see at programme follow-up, people rated their health as much better than at programme entry. So next slide, please. So some of the key success factors I mentioned earlier, so where the programme we think worked especially well was where we had sustained, proactive strategies to reach the most isolated. So projects who are using multiple routes to engage participants through referrals from other organisations, outreach, so direct outreach on the streets, or word of mouth. And particularly for the community and voluntary sector who ran all of these projects, those which had very deep trusted engagement with communities were really successful in terms of word of mouth and getting people into projects. The programme had a really nice balance between projects offering social contact and support for those not initially ready to connect. If you've been isolated for long periods, you do need support to be able to then rejoin activities. And there were some very good examples of people being really taken through to being ready to join in community activities. The provision of regular, meaningful and shared activities was really important. And of course, what's meaningful varies across different groups. And this really shows the value of the Older People's Committee and involving older people in determining what projects are developed, what activities. And some of the projects were very, very good at being inclusive and allowing older people to direct the activities. Of course, as you might anticipate, the skills and quality of the project staff and project environment were really key. You know, sometimes very small things about the rooms being made nice, friendly environments, so key for trying to encourage social contact. And what worked particularly well is these projects themselves acted as a bridge for other projects. So projects could refer participants onto other things going on in the community, which was really great for sustained engagement. So my final slide, please. So what we found from the evaluation is that this programme, although there was lots of learning from it and things perhaps that would have been doing differently, is really promising in terms of the impact on loneliness and improving health and well-being. And we think there's a really good case to try to embed this approach within the system to continue to make sure that older people do continue to have social activities. As I mentioned, our findings are in line with the existing evidence base on how to reduce loneliness and social isolation, and the national evaluation of Ageing Better is also supporting these local findings. So I think continued attention to these key success factors around reaching the most marginalised groups and those at greatest risk needs to be built into any ongoing and mainstreaming strategy of this type of approach. And just the last slide is just to refer you back to those 14 recommendations that Judy has shared with you. Sorry, could you go on to the next slide? Which are formed from really practical recommendations from the really in-depth qualitative research we've done on a variety of topics, ranging from digital inclusion through to community connectors, through to co-production with older people. And I think Hackney CVS and the Older People's Committee would really recommend that these programmes inform the development of the Health and Wellbeing Strategy Action Plan. Thank you.
Thank you, Angela. This presentation and the report that it is based on prove the value of the programme in reaching lonely older people, increasing their well-being and improving their health. Thank you.
We know the evaluation findings will be of benefit to all older people across Hackney and beyond. Our request to the board is that the findings from the evaluation are used to inform the Health and Wellbeing Strategy Action Plan.
Thank you again for everybody who was involved today. And if you have any questions for us, the CVS, I'm sure the team will have answers for you. Thank you.
Thank you. And we'll be happy to take any questions now.
Thank you so much, both for Angela and the older people's representatives in HCVS, and your passion for this project. I think is something that if you look at the list of organisations, hopefully it's touched everyone on this call. There's some real, I think there's just that sense of joy and elders' ownership of the project. I know when I get given the magazine, it is filled with just moments of passion. And Hackney, you know, very visible Hackney. I remember the souvenir edition around Windrush, and I know that you have contributed collectively so much to the life of the borough during the project. We could spend the whole meeting on this item, and I would actually, because just even hearing from you is probably one of the most joyous moments of today and reading this report. I want to maybe, I know you, Councillor Kennedy, you chair or involved, Councillor Maxwell as well, are involved in sort of chairing the Connect Hackney work. We've also got the Ageing Well strategy and the health and wellbeing strategy that's emerging, which you've very pointedly said needs to take the lessons learned from this work, as well as all the other commissioning and funding decisions. There's the 14 recommendations in the report. What I'm sort of seeking from the collective knowledge on the call is where we go next. Really with this, because we could very easily say yes, noted, but there's some real, I feels like it needs a report back from the system to this, because it is such a detailed set of questions to us, and we really need to kind of, you know, it reminds me of the Hackney Wick through RI's report and what that needed to sort of see genuine change. Where else are you reporting to? I presume the lottery. But are there other parts of the system where this report is going? I'm thinking of some of the other boards and decision makers. How do you think we should best respond? Was my idea enough? There is that slight concern and niggle that I have that at the very moment we're identifying kind of isolation and a community response as a key priority of the Health and Wellbeing Board, we're seeing this project come to an end and this funding and investment come to an end without absolute clarity how we take those lessons and mainstream some of this work. Now, we don't have the money that the lottery brought in necessarily, but what do we go back to the lottery as a collective? Do we go to other funders? Where can we go to kind of make sure that this doesn't fall away and the lives that it's enriched and the future lives it could enrich could do this work? And there's also other things, aren't there, that underpin this that face their own funding challenges, Councillor Kennedy as well. So I've unpacked a lot there, but you triggered a lot in me, and just thank you so much indeed. I wish I was actually in HCVS with you rather than on this slightly weird throne that I'm sat on. Deputy Mayor Bramble.
Thank you, Chair. It would be really good to see how we could link this into the broader work we're doing with young people around intergenerational work. I think this will be a really good opportunity to think about how that looks like through the council and using this organisation and the brilliant older people that presented as a resource for us. Thank you, Chair.
Yeah, I know. Yeah, absolutely, and I know Councillor Maxwell believes in that as well. Other colleagues. Councillor Kennedy.
Thank you. Lovely report, and I just love the way you presented it. Thank you very much. And the Mayor hinted at it. There are synergies with so much work that's going on elsewhere. The Ageing Well strategy, let us remember, is a living document. We based it on the World Health Organization Age-Friendly Cities, and that looks every year at what you're doing, how you're interacting, what you're providing for your older citizens and your older residents. Many of your recommendations absolutely chime with the work that will continue to go on through the Ageing Well strategy, but it also chimes with what we've just done with our grants provision, in the fact that we've introduced within our community grants provision, we passed it at Cabinet last week, a £400,000 core grant fund for organisations to establish and stabilize themselves. The work we're doing work at the moment on libraries, so that chimes in with your recommendation 12. We're looking overall as a council at how we use our buildings and how our buildings can support community activity, like all the kind of things that have been going on through Connect Hackney. And of course, it absolutely, especially your findings, are sort of like part of the backbone of one of the main recommendations of our revised health and wellbeing strategy. So thanks. I think there are many places where council activity can be informed, continue to be informed by the recommendations of this report. I'm tempted to say that whilst welcoming them all, we don't want to just do a big tick and say, yes, they're all fantastic. What we do want to make is to make some sort of commitment, like you said, as the report back on Hackney Wick Through Young Eyes, is how we as an organisation will come back to these recommendations in 2 years and be able to, perhaps we should be that bold and make a challenge and say, we'll show how we've implemented these and how we've worked on these.
Thank you.
That'd be okay.
Just 1 second. Can I just have Mark in and then we'll go back to Connect Hackney. Mark.
Great, thank you. I mean, there's so much to kind of admire and about this work and as illustrated in the report. So thank you so much for that and for all you're doing. It just lots of kind of, as Meg Glanville said, lots of triggers going off in my head about various things. I mean, it's just some of the data you presented, the figures around the people who are lonely presenting in the age group 50 to 59 and whether we're seeing, whether that's just because they seem to be more motivated to come forward to engage, and it's a kind of, it's a selection thing, or is it we're looking at a group of people between 40 and 50 who are increasingly socially isolated, and we're looking at an increasing cohorts. Anyway, there's all sorts of things to explore further, and I'm sure you will. I'm also thinking about within the context of the integrated care partnership, looking at the, taking the work of the health and wellbeing board strategy in terms of the health elements, and but of course health elements go beyond just the conventional health. They go into the wider determinants and prevention, and thinking about the population health hub and the work they're pulling together as a new group, and talking again about reinvigorating our prevention investment standard work. Because it's very clear that social isolation is a very potent factor in causing all manner of ill health further down the line, not just psychological, but very real physical illnesses. So there's all sorts of potential here to try and explore how these sorts of initiatives could be further supported. I don't want to kind of overpromise in this context right here and now, but certainly it's got a lot of people's attention, and I think that's got to be to the good.
Thanks, Mark. And you remind me, I think you eloquently said you don't wake up one morning isolated, that it evolves. And there was a case study, I think, at the Integrated Commissioning Board that I saw a year and a half ago, which provided that sort of journey for somebody becoming quite socially isolated and then their physical and mental health deteriorating. And then the people that saw it but then didn't know how to sort of act, so the housing manager, the GP, and social prescribing, the kind of work that was going on in developing primary care networks, and that prevention standard that you talked about, Mark, was very much supposed to be the response to that at that sort of level. I'm going to go over to Connect Hackney because they definitely want to say more. And then I'm gonna deliver some actions, hopefully, that the boards will agree to, as well as noting these recommendations.
Yeah, just to say, as might be apparent, we're still trying to figure out what the system is and how you input into it. So that's kind of a process for us, and we have been really lucky to have the support of Councillor Maxwell and Councillor Kennedy, and we're working with Soraya Zahid, who's been amazing on the ageing well strategy. So that's all happening. We're going to do a few show and tell sessions, I think, on different topics with the council, and we're working with the Population Health Hub who've been just brilliant in helping us set up meetings. We've got a meeting with Penny Heron we're going to try and set up about our learning disabilities recommendations, and with the trying to input into the service specification for the system kind of navigation design work that's going on, and more stuff like that is coming to fruition. And then we have got the possibility of staying on for another year, just not delivering any activities, but sharing our findings and learning with the older people, with the older people being at the forefront of doing that through events and more kind of learning, and doing that with the third sector, embedding our learning in the third sector, as well as with funders and commissioners and policymakers. And one in the bid we have going in about that at the moment is that the outcomes of that would be to secure the adoption of our recommendations. So we would be measuring ourselves against that target as well. And then the final thing was, in our bid as well, if we carried on for another year sharing our learning, a piece of what we would be doing would be about fundraising and sustainability to ensure there are activities for older people, and that they're delivered in the way that enables people to be reached and to make social connections. Thank you. Oh, I'm sorry, we also have a meeting set up with Sarah Bainbridge, the registrar. So we'll be working with her to share our learning there as well. But the system, we don't really know, when people say the system, we don't know what that is, just to say.
Thank you so much. So I think the action must be that we do provide a response to the paper. Whether we get that, given all the other work that's happening by March, but I would like to suggest it within the next 6 months, and that as we do that, we can track what you're doing. If you get that extension and some of the meetings and discussions that you're talking about, I'd like us to collectively keep it in our minds for that future work that we will be doing in March. I've certainly taken those recommendations very, very much to heart. And then I think Councillor Kennedy's proposal, and perhaps we'll have a discussion with Councillor Maxwell, what our sort of, onward then monitoring and impact is. Mark's made the offer to sort of take it back as well, I think, in terms of that prevention investment standard. The last bit I would find really useful offline is if any of the projects are at risk and the value that they add to the system, just knowing that early as we go into the next financial year. I'm not saying we can fund every project listed here, and every project isn't active necessarily that's listed here, because it took place previously and it was task finish, it was a one-off or what have you. But I'm just thinking of some of the sort of quasi-infrastructure things that you've been doing. I'd certainly really value so that we can think about that in terms of gaps in the system and things like that. But just really powerful, and keep us honest. You've seen the public question time at the start of the meeting that Health Watch, as well as Claire did. If you don't feel we've come back to you, you can come and see us, whether you're on the agenda or not, and hold us to account. And I'm sure Health Scrutiny would also welcome the opportunity to engage with this report. Really powerful. Thank you very much indeed, and stay safe, and thank you so much.
Thank you very much. Goodbye.
Technically, I'm about to lose my laptop, but we do have one last item. I know a few colleagues are having to leave, but we do have the sexual health recommissioning paper. Zina's waited very patiently for that item. So if we can just do it justice, I'll hand over without further ado.
Thank you, Mayor Glanville. This full information paper outlines the current situation with regards to the commissioning of services to support the sexual and reproductive health of our local populations in Hackney and the City. As you know, a range of services is commissioned, including universal open access and targeted services. And underpinning this commissioning is collaboration with local partners, including the CCG and NHS, among others, as well as a drive to tackle and reduce health inequalities, as there are significant inequalities seen within sexual health. This paper also summarises plans underway for a local sexual and reproductive health needs assessment, a women's reproductive health survey, and sexual health strategy. I'm happy to take any questions.
Thank you very much. I had the sort of privilege of discussing elements of this with public health colleagues outside of the meeting. I would rehearse some of my sort of feedback, but I'm conscious of time. Is there any other questions or contributions? I think this is the sort of start of a process, obviously, isn't it? Rather than the end. What more would you want from us, Zena? I know it's a sort of late hour in terms of the meeting overrunning, but I'm just conscious of what you'd hope to sort of come out of the meeting, or any points you want to just prod.
Thank you, Mayor Glanville. So really, it was just there is a lot of changes happening in terms of our services at the moment. So lots of commissioning, recommissioning, particularly because we did have to put quite a lot of that activity on hold due to COVID. So it was more about sort of sharing the information and just refreshing understanding and information about the services that are available. And if anyone did have any questions about particular services, always happy to talk about them if you wanted to pick it up outside of the service. And really just as a very quick update in terms of the sort of work that we're planning around these sort of needs assessments, looking at the services in quite a lot of detail to inform further commissioning activity as well.
Thank you. Any questions or comments? I don't have any. I regret, Zena. I think we really welcome what you just said, and you added that extra layer. I think we would like to stay engaged. I'm sure it's also being tracked elsewhere as well. Clearly, it's an area of work that it's been through significant change and pressure due to COVID. We've also got the work that we're doing around PrEP. That's a bit of a new frontier with the new funding. And I suppose we welcome sort of further updates and engagement, and please track us down outside of the meeting if you need more. Thank you. Okay, so we've got the forward plan. So I'm having to do this on my mobile phone because the battery's gone on the laptop. So as we indicated earlier, and I think we are going to split our meeting on the 9th of March. Between the update on the anchor institutions work and health and all policies. We've got the community voice element of that item and an adder update, and then move into the closed workshop on the health and wellbeing strategy. So bring your best selves, having engaged in that final evolution of the report and the consultation, and hopefully a point where we can really, we've already this afternoon, there were 2 substantive items that I think give us lots of food for thought about how that sort of develops and moves into an action plan stage. But so that'll be a closed session. There will obviously be the public elements and the COVID update, and then we'll reconvene after the local elections in June 2022, and you can see the items for yourself there. And I don't think, unless Donna, there was anything else. Deputy Mayor Bramble.
Thank you, Mayor Glanville. Can I suggest that the work of the young black men in terms of health and wellbeing be brought back for a deeper dive at some point on the agenda, please?
Thank you. Have you got that, sort of, Donna and Peter? Yeah.
And I was just going to add to that, if any members do have any agenda items that they'd like to see on the forward plan, to just get in touch with me and Donna Doherty Kelly on a Hackney account, and I can add that to the forward plan.
Thank you. And I did want to, on that forward plan update, we've obviously got the climate item for next summer. We did pick up last time we discussed it, last time we discussed it, obviously the impact of climate change, heating, cooling, air pollution, and other factors. We're getting the update on parks and green spaces. There's obviously opportunity to look at air quality perhaps in that suite of items. I don't want to overload the meeting and not do it justice. And obviously they are very distinct things as well, whereas climate change and air quality are linked. They're not always the same issue, and they can get conflated and confused. but that's an option and opportunity, because when I was hinting that we might be able to look at it. But I think other than that, comments to Donna, and thank you very much for persevering. We covered a huge amount of ground and many different policy areas this afternoon. I look forward to Mark's better chairing on March the 9th, and wish you a very safe and healthy start to the new year. Thank you.